So kind of my mission in life, you know me, a lot of you know me. I have a 34-year-old with the syndrome, and I'm a former teacher. And, you know, over the years really is to try to give back to the community. And I drew on my area of expertise, which is education, and after attending probably 20 or 30 conferences with this around the syndrome, to try to take the research and translate the research into actual use to families, so that we are taking what we learn in the research community and applying it to the educational process, because so many parents have such trouble with schools and really trying to figure out a plan for their children. So the mission started off with the Dempster Foundation, but then translated into the 22Q Family Foundation, is really to help families navigate schools and navigate IEP processes and try to advocate for services for the children, and to do it from an informed perspective. Because as Lindsay mentioned, you can get an advocate, but the advocate doesn't have the wealth of experience with the syndrome. And what we try to bring to the table is the nuances that are necessary to really understand the challenges that children with 22Q have. So what tests to do, you know, what are important pieces of the IEP to add in, you know, to take care of some of the social and emotional pieces that school districts, if you don't know about the syndrome, and most of them know nothing about the syndrome, have no idea that these are pieces of what really needs to be pulled together to a school program. So the education station was started, and what this is it's a free service to families. It's assistance with any type of school issue. So there's reviewing IEPs, recommending testing, interpreting the testing results, programming and writing effective goals in the IEP. Some of it has to do with placement and school searches. Some families are pretty frustrated with the district and want to look for a private school placement, so we can help take a look at those schools and even contact the school and find out, you know, through dialogue if it would be a good placement. We've done PowerPoint presentations for staff. We have done some mediation and due process where, you know, I've sat in on mediations and tried to advocate on behalf of the youngster with 22Q, and then work with community supports to transition that young adult into independent living and into the community. Another piece of what we do also for some families is to apply for SSI funding, and what kind of letters to write, what kind of documentation to have. It's a very hands-on, personalized approach. So it's not generalization, because as you know, it's very individualized in this syndrome, and one size does not apply to everybody. So it has to be really tailored to each individual person. So just some statistics that I'm pretty proud of from the beginning of Education Station. We've really had direct personalized service to over 200 families with the syndrome. We've helped over 18 families apply for SSI support. There's been over 1,000 staff members, school staff members trained in the syndrome. There are 80 different school districts that we've been involved with. And within those, there's been 170 different instances where programs have been changed, and 84 different instances where services were added. So kids didn't have aides or paras in the classroom, and we've been able to pull that in. So not everybody that calls needs involvement in IEP. Sometimes it's the little child, it's early diagnosis, but for those families where we get involved really in the IEP process, there's more times than not, really probably 90+% of the time, we're able to get the school district to provide more services. So, you know, I think in that respect, I feel very proud of the work that Education Station has accomplished. The Career Accelerator was added on to this program because there was a void in really how to get from high school to independent life. And a lot of these kids really, the data, and when I do my research review this afternoon, there are a lot of adults with this syndrome that are working. So job placement is a real possibility for most children with this syndrome. So one of the things, though, that's a little bit confusing is how we get that job and how we apply for the job and how we do resumes and how to practice for a job interview. This isn't a slam dunk for kids with 22q. They need practice with this. So the Career Accelerator was started as a way to have, again, hands-on support to the 22q young adult to help them figure out what they're interested in, to look at different possibilities for jobs and if there's a match, to explore college options. And when you think of college, I want people to start expanding their thinking because there are more colleges on the horizon now that are catering to children with disabilities. So I think it's something that you're going to find is going to change quite a bit in the next 5 to 10 years, where there are programs that are more inclusive. So what colleges would be appropriate? Some children with the syndrome go to a typical community college or a 2 or 4 year college. Others need something that's a more specialized program. And then Jason Osborne has volunteered graciously to do one-on-one personal assistance, which includes interview practice and resume writing. So it's actual hands-on help. So since the Career Accelerator was launched in March, there have been 40 different people that have signed up for the service. Jason has assisted with 8 different resumes and has, pulled together 11 different job interview practice sessions with kids. And, there's been a lot of outside sessions, about 92 different sessions involved with people logging in and actually using the searches. And, over 200 job searches through the site. So that's exciting because it's a tool. I mean, what this is a tool that's available to families. And I actually have been recommending this to school districts because when I'm in transition meetings and it's around a child with 22q, I let them know about this program because they have counselors at school or case managers that could also log into this program and do that resume writing and interest inventory using the tool.